I am the Tobacco Cessation and Quitline Specialist for the Missouri Department of Health and Senior Services, and then Kara Kikuchi is our Quitline provider. And so we're just going to kind of walk through this case form and see if we get some good feedback and some good questions on how to improve some of our systems. Basically, what we want to do is we want to increase the conversion rates for patients, and then for this project, the public housing residents who are referred to the Quitline. We want to ensure that the patient, first of all, gets connected to the Quitline, and then beyond that, actually enrolls into some coaching services so we can get them the help that they need. Currently, what's happening is that the providers and public housing authority staff make either passive or proactive referrals to the Quitline. A passive referral would be just kind of giving them the 1-800-QUIT-NOW phone number or maybe a referral card to use, and then it leaves it up to the patient or the resident to call in and connect with the Quitline independently. A proactive referral is when we utilize the fax referral form, and the provider would sit down with the patient and discuss the form, fill it out together, and then that gives the Quitline some information that they need, and then the Quitline would reach out within a couple of days. The Quitline would reach out to the participant and hopefully enroll them into services. Once the Quitline will make 5 call attempts to reach the tobacco user. Once the patient connects with the Quitline, then he or she either enrolls into a telephone or a web coaching program, or they can select from a menu of individual services, or they sometimes decide not to move forward and make a quit attempt, and that's kind of the end of the interaction with the Quitline. Ideally, I think what we would maybe like to see happen would be the providers and the resident agency staff could implement a proactive fax referral process and follow up with patients and residents when they've got them right there in their office to hopefully ensure that the Quitline services are accessed. We'd like for providers to go ahead and engage in what we call a brief tobacco cessation intervention. It's the ask, assess, and refer method. And then really encourage and motivate those tobacco users and inform them of what they can expect when they do connect, when they talk to a Quitline person. And then, you know, those kinds of things might include what the services offered would be, what the callback expectations would be. A lot of times, I think people just don't answer the phone when the Quitline calls because of caller ID and they don't recognize the number. And so, I mean, I know I do this too. I just don't answer if I don't know the number. So maybe if we can provide healthcare providers with the number that's actually going to show up on the caller ID, and then they can let patients know that, now listen, I'm going to fax this form and the Quitline's going to call you. So make sure you answer, even if you don't know the number. You know, it'll be a toll-free number or an 866 or something like that. So we're hoping that if on the front end of the referral, we can just prepare the tobacco users as much as we possibly can on how it's going to work, and you know, what they can expect from the Quitline. Let's see, so have there been any recent changes in the last 6 months? We haven't had any recent changes, but we've got a lot of exciting things sort of in process. We're going to publish a new fax referral form and frequently asked question companion document in the next couple of months. We've been working for a really long time with our Quitline provider to develop an online training for healthcare providers that's going to educate them on the brief tobacco intervention, an overview of the Quitline, how to make a referral, and we've got lots of other resources along with that. So that should launch within the next couple of months as well. We've also been building a big provider campaign. You know, basically it's, I think our tagline is ask, it matters, every patient, every visit. And then of course, just really encouraging healthcare providers to go ahead and do that brief tobacco intervention, and then follow through with some treatment, prescription either for nicotine replacement therapies or oral medications. Let's see. So we've got a lot of things that are going to be happening in the next, 3 to 6 months, and we're really excited about that. Let's see. And then the other thing is, what data do we have that supports our observations? So far this year, of the patients that were fax referred to the Quitline, and this is when the Quitline will call them, make 5 attempts, only a little over half of those patients actually were reached by phone. And then of those, only 26.6%, 26.6% actually declined to move forward with the Quitline and make a quit attempt. So, we really are hoping we can get some good insight from either other Quitline providers or other state Quitlines to help us improve these rates. My understanding is that this is not unique to Missouri, that, a lot of other states, Quitlines are experiencing the same kind of issues. So, so that's basically what we've got, and we're trying to help people connect with the Quitline and make those quit attempts.
Love it. Thanks, Leslie.
Right.
Kara, anything?
Oh, sure. Thank you, Rich. I just wanted to add too that, of course, what we're talking about and what Leslie mentioned is that doing a fax referral is ideal because then we're having those proactive contacts from the Quitline to your patient. But of course, another way of stating this, the data that you're seeing there is that if you're faxing 100 patients over and only 15 of them actually accept services out of that 100, that is really not the best use of your time as a provider or a service provider. And so our question is really, how do we, again, as Leslie said, prepare those patients so that they're more likely to actually take that call, accept the services? Is there, do we need to really assess before we refer them as well so that they're ready to quit, and we only refer the ready to quit people, so they're more likely to take those, to actually enroll in the Quitline? So just another way of thinking about the data there.
Thanks, Kara.
Yeah, thank you. So let me open it up for questions first. Let me start with the faculty. Any questions for Leslie or Kara?
Yeah, Rich, one quick question. And of those who declined services, did you go back or did you ask them why they declined the services?
Leslie, I'm not sure if that is part of the evaluation plan that you have with the declined callers. We certainly have, I know you have an evaluation plan for participants who have actually accepted services, but I don't think we have the information on the ones that have declined.
You're right, Kara. That hasn't been historically part of our evaluation process. It is something to think about moving forward with future evaluations, though. Yeah.
So this is Steve. A question: how familiar are your clinicians with the Quitline? Because in my experience, the enthusiastic support of the Quitline and the reinforcement at the beginning is going to increase the probability that the patient will accept the call or the fax and make an engagement in the process. So if they're already on board and know about it, that's great. If not, it maybe speaks to an education process to familiarize the clinicians with what Quitlines are and how capable they are.
I would agree with that, Steve. Right now, and that's part of what we've been working toward for the last year or so with building this big provider campaign. And with that is a huge website with lots of materials for providers. And then of course, along with that, we're building a campaign for actual tobacco users. So we're trying to drive the patients to the physicians, and then the physicians, we're trying to prepare the physicians to better assist those patients who want to quit. So yeah, I think there is definitely more that we could do on our end to raise the awareness of the Quitline. And then also beyond that, not only just that it exists, but how it works and what patients can expect. I think that would be, helpful at the very beginning, when the physicians are doing the brief intervention and then making those referrals, that they can really prepare those patients for what's going to happen next. So yeah, that's part of all of these things we've sort of been working toward the last year or so. And so we're really excited that that's getting ready to launch here in the next maybe 3 to 6 months.
Right. We kind of have a baseline right now. And so once those provider education and provider support services do launch, it will give us, I think it will give us a chance to see how that can have an impact on these conversion rates.
And the educational effort is so important, and it sounds great that you're going beyond just the providers. So if you can even do something with the PHAs as well as with the providers and maybe community-based organizations, faith-based folks as well. Recently we did something similar with CDC tips for smokers. And in the health centers and PHAs we targeted, we got about a 10-fold increase in the number of patients who are interested in quitting. And we also got a great increase amongst the providers for participating in the whole process and tobacco cessation and counseling groups and all the rest. So it was really a win-win. And so, we were talking about GASO earlier. So if there's some way to tie all that stuff together, maybe you can get a whole bunch of people interested.
Yeah,
I have a
makes
couple
sense.
of thoughts. So have you ever called your Quitline and asked them if they can talk to their phone provider so that it is identified as the Quitline when people see the, on their caller ID? I don't know that much about computers, but I would think that that's a very simple thing to do. So I think it might be worth a phone call. And number two, I don't think you can do this, with doctors because they simply don't have enough time. But if you have other professions or you have counselors referring people, why not do a little pilot study and try having the client call the Quitline right in the room with the counselor so that they know that they're connected, and then the counselor can then answer any questions or deal with any concerns after the phone call. Maybe do that with 10 people and see how that works, if it's feasible, if it's not. And that might be another way to definitely increase the contact rates.
Thank you, Frank. I can speak to the issue of the phone number coming through. So if it is a landline, I believe that 1-800-QUIT-NOW will come through on the caller ID. So, there may be some education that needs to happen around knowing that is the Quitline. As far as for that information to come through on cell phones, what we've run into is that it really depends on the cellular service provider in a lot of cases. So it is a little more complicated taking that into consideration, but certainly it has been something that Optum that we've been looking at as a concern.
Gotcha.
Yeah, this is Amy Score from University of Wisconsin, and we're dealing with that same exact thing with the phone numbers, and people these days are not going to pick up a phone number that they don't know, and we've learned too that it does differ based on service providers. Yes, so we've put together just a one-pager for patients that are referred. That's somewhat helpful. It's also a little outdated with it being a paper form. You can also print that on after visit summaries if they're in with their doctor, but trying to get just some information out to to those that are referred, again, what to expect, all of the services. And then we do have a little blurb on caller ID information. So just letting them know that it's going to show in different ways depending on your phone company, that sometimes the Quitline can leave voicemail. So to make sure that you're checking those, and also that they can always call the Quitline back on their own. So they don't have to necessarily wait to get connected from that outbound call coming from the Quitline, that they can make that then proactive call in themselves and get connected that way if they're really hesitant about picking up the phone number or the phone from the Quitline or an unknown number. So that's something that we push providers to hand out a lot. And it's great that you guys are doing the online training. My eyes lit up when I heard that, because that's one of our key messages, is that how important that training is, so that everyone who's using the referral methods, that they're aware of all of the services, that they feel comfortable sharing those services, that they can really highlight the free services, try to find out what's going to be most motivating to people to using the Quitline, but then just the education again about Quitline phone number, what to expect, how often they're going to be expected to receive those calls until they pick up, but also that there's no commitment required as well. So some people might think that they're getting into this huge commitment and they're going to have several phone calls every single week, and or that if they pick up the phone that they're going to have to be looped into something. So just letting them know that there's really no commitment. If you pick up the phone and you're not interested, you can kind of opt out of that. Frank had mentioned about being able to call into the Quitline either with that person or having the provider call in to see the number. That's something else that we encourage providers to do, would just be calling the Quitline themselves, not only to maybe see a phone number or that sort of thing, but to get familiar with those services. So just to let the Quitline know that they're a provider. They kind of want to see that process, again, just to get really comfortable with the services, how that's set up, so that they can give the best information to the person that they're referring. One other point I wanted to mention too would be any feedback from referrals. So I don't know if currently providers or those who are referring are getting feedback back to them about outcomes of referrals, but that can be a big motivating factor as well. If somebody's receiving those outcomes, they kind of know what's happening with those referrals. That can be an encouragement to them to continue. They see a couple of patients that got connected, for them to continue to make those referrals. I guess one other point I have too, a lot of information on this, would be some good candidates for a fax to quit referral. So you mentioned that assessment piece, and I think that's very important before you're making those referrals, to hopefully get those that are most likely to pick up the phone. So we call those the good candidates for the referral, especially those that are ready to quit. They're motivated to use the Quitline services. They know what those are. They're open to that, have constant access to a cell phone or phone, that sort of thing. So making sure that we're kind of choosing those good candidates and not just referring everyone who walks through the door that's a tobacco user. So I'll leave you with that.
Thanks, Amy. That's really helpful. We do, providers do receive a participant outcome report on every fax referral that they send to the Quitline. So yeah, that's helpful.
Great. Yeah, and we also see many providers, competition. Providers can be very competitive. So, trying to find some way that they can be, competitive, or comparing their rates and having, an enrollment goal. So we like to say 50% of patients that are referred are going to be enrolled. That's kind of setting the bar high, but even at 20% or something like that, that's kind of an attainable goal, and they can see from those outcomes kind of how they're going to eventually meet that.
Love that, love that. Let me just jump in really quickly with just 2 questions from the chat. Can the Quitlines get their names on phone numbers to say state Quitline or something similar when they call? And also, can you send a text message first so they know the call is coming? Kara, I'm not sure if you have any experience, or even Amy in your work.
I'm trying to,
Go ahead, Amy, sorry.
Yeah, I think it really depends on the carrier. The Quitline might have to do some work with individual cell phone providers to be able to get their number to say something specific. I don't know if that has happened before. I know that we don't have that capacity. We haven't done that yet here in Wisconsin, but we are really looking into trying to find a way to deal with the caller ID issue, because that's one of our biggest barriers. But I don't have the answer to that one.
Right, and I can speak a little bit to the text message question. I know that that is something that, you know, that idea has been brought up, and so it's being investigated and as a possible solution, especially for those cell phone users. So great question.
This
Any
is
other
Becky.
questions?
I wanted to, yeah, this is Amy. Just the one pager that you mentioned, is that specific to Wisconsin, or do you have different ones for different states?
Yes, so that is specific to our Wisconsin Tobacco Quitline. It's actually available on our website, and I can send that to you too, so you can modify the text on there, Becky, if you want to send that out. But it does just highlight Wisconsin services, but some of the information would be applicable to any Quitline in general too.
Yeah, that would be great if we could see that, and then maybe we can develop our own.
Yeah, absolutely.
Great, I'll get that out to everybody. Thanks, Amy.
Just had a quick question for Leslie and Kara. Leslie and Kara, I mean, you guys have done a really thorough job on this. I mean, you really kind of thought about, you know, all the possibilities. So it's really impressive. I'm just curious, in terms of the case management, upfront counseling and motivating the person to interact with the Quitline, and then follow up after they've used the Quitline. And I'm just curious as to what kind of, success rate you're getting, you know, after they go through the Quitline process.
So are you speaking to how the success rate with the provider then going back, or the referrer going back and engaging that participant again?
Yeah.
Yeah. I'm not aware of any analysis of that or any data related to that piece.
Okay, it's something you may want to consider, because, you know, obviously the Quitline services themselves have a limited duration, especially in terms of, you know, the nicotine replacement and some of the other, services they can provide. And so, you know, everybody was talking about motivation, you know, and I guess, you know, Frank can talk to that because he's kind of the king of motivational interviewing and all that. But, you know, you've got to do your best to get them in the door, and then sometimes you got to help them stay in the door, and then you may need to give them some follow-up afterwards just to get that, you know, that ultimate quit which you're striving for. And I don't know if Frank has a thought on how to get them in the door.
Not really, not off the top of my head. Yeah, I like the idea of having the provider call the Quitline with them right in the room and seeing how that would work. I don't think it's done very much, so I just think that might be worth a try just to see if that works.
I know that some of our health centers have implemented a workflow to have MAs or possibly community health workers.
Yep.
Is that something for our CHCs on the Echo today who have done that? Is that something that's happening? And is it successful? All right, well, that's something to look into a little bit more. I can ask that in my follow-up email, but I would be very curious how it's going. All right.
Just one other quick thought. I'm wondering how the providers are telling the clients to call the Quitline. Are they making it seem like a priority, seem like it's important, seem like this is something that I'm really urging you to do, or is it kind of just a sort of suggestion? I think that might be something to look into about how the message is being presented to the person.
Yeah, Frank, agreed. And I hate to do this. I really do. I really hate to do this, but just out of respect for Pennsylvania, who's about to come with the CAP progress update, I just want to wrap this section up. And I'm sorry to shut down the conversation, but we'll follow up with the recommendations in the case presentation form like we have done in the past. So thank you, Leslie and Kara, and all the faculty for your questions and feedback on that. It's just always such rich conversation. I just hate to shut it down, but I do want to just allow us to move forward to Pennsylvania.
Thanks, Rich, and
Thank you.
thanks everybody for all the good insight and information.